Hello. In this video I'm going to show you how to use the point-of-care tool ACP Smart Medicine. You've probably already seen other point-of-care tools like Dynamed or UpToDate. I would say in terms of how easy it is to use and how quick the resources come back, answers come back, the ACP Smart Medicine falls in between the two. Dynamed is by far the fastest resource to use. They promise you an answer in 30 seconds or less. As you know, UpToDate is like a textbook. It has really good information, but it can take you minutes to read the entire thing. It's very, very long. It's what we as librarians really call a monograph. As I said, ACP Smart Medicine falls in between. It's a very comprehensive resource. It is like a textbook chapter, but it's broken up into many, many smaller components, so you can really just sort of zero in on the portion of that you'd like. And it really covers the topic from A to Z, so it'll talk about things like prevention, screening, therapy, counseling, and even in some cases, for someone like me, it's great that it'll actually give you an example of a question you can use if you want to teach that particular topic. So thinking about that, teaching that particular topic, I'm using a hypothetical patient here, Judith. You may have seen this before. We use this case quite a bit. So say, for example, you are a physician and this is your patient. This is the scenario right here. So you have this patient, Judith, a 65-year-old woman, recently diagnosed with type 2 diabetes. You recommend that she should use a home glucose monitor to help control her glycemic control. She says she's not interested in using a glucometer, that she has a neighbor who's diabetic, that found that the meter isn't very useful, it's painful to prick your skin numerous times a day, it's inconvenient. So Judith would really like you to find compelling evidence for her to recommend your decision to use a glucometer. And you can see here is our clinical question here. After our PICO, of course, would be 65-year-old woman, recently diagnosed with type 2 diabetes, comparison to be intervention to be, in this case, using a glucometer, comparison to be no use of glucometer, or null comparison, outcome, better or equal control of her diabetes. So our clinical question would be, does the use of a home glucose monitor by patients compared to no use improve glycemic control among adult patients with type 2 diabetes? So as always the case when you want to use any of our ebook resources, you're going to start here obviously at the medical library, medlib.bu.edu. I'm just going to click here under e-resources and go down to ebooks. All of our most popular ebook suites and point-of-care tools are here in this little box marked Quick Links. And of course, here's ACP Smart Surgery. Sorry, ACP Smart Medicine. Similar tool, just different in this. We actually want to use Smart Medicine in this case. So ACP is actually the American College of Physicians, a very well-respected resource of doctors in the United States. So they create different sorts of tools to help other physicians, and ACP Smart Medicine is probably the most popular one. It used to be called ACP Peer. You may have heard of that before, but same product now, just with a different name and some different features. Okay, so you can see this is just an alphabetical list of titles we get from StatRef. StatRef is just a provider of these sort of electronic books all in one place. So I'm just going to click here, obviously, where it says ACP Smart Medicine. So there are two different tools here, ACP Smart Medicine and this HFSDI Essentials. So I'm going to go with ACP Smart Medicine. I'm just going to click here. And what I want to do in this case, because we have a question about type 2 diabetes, about a disease, I'm just going to click here on this heading for diseases. And then obviously, because we're looking for diabetes, I'm just going to click here on D. So these are all of the diseases that ACP Smart Medicine has sort of chapters about. And because Judith has type 2 diabetes, you're going to come down here to type 2 diabetes mellitus, and just click here on this little sheet of paper with this green arrow to get to the full text of that particular section. So as I said, it's really nice in that if I explode this a bit so you can see what's actually here, it does cover this topic, like I said, from A to Z. So you can see key points, prevention, screening, diagnosis, consultation, hospitalization, and so on. They really try to give you a really thorough breakdown of that particular topic all the way through. So I know that from doing this search before that our particular question about Judith is going to be under therapy. And as I look at therapy, you can see that every one of these sections in therapy, they give you this recommendation right here on a scale from A through F, as we see in other point-of-care tools, the other sorts of criteria you're used to. So a C in this case is really average evidence. They really can't recommend it's worth doing or not worth doing. The evidence isn't there. Whereas you can see, for example, this therapy, it's an A and a B, so the evidence is really, really strong. So I actually want to find the one about home glucose monitoring. Now I could just scroll through here, but of course we're using a web page as an easier way to do this. I'm just going to go up to the top and I just want to search Control F for home glucose monitoring. I can't type or spell, so bear with me here. Okay, so we can see that it shows up on this page 7 times. So it's going to jump down here. Okay, here, perfect. This is the one I want. So you see it says consider home glucose monitoring for select patients with type 2 diabetes, which is Judith. And if you're interested, this is under that therapy heading because this is also highlighted where this actually showed up. And again, it tells us the level of evidence here is a C. So preponderance of data supporting this statement is derived from level 3 studies, which meet none of the evidence criteria for that study type or are derived from expert opinion, commentary, consensus. This, frankly, is pretty weak evidence. So I would not want to base my recommendation to Judith or any patient on level C evidence. So we've talked about the workflow before, so you probably, in this case, if you're looking at just point of care tools, if you looked at Dynamed previously, Dynamed probably would give you the same answer, level 3 evidence in the case of Dynamed. Excuse me. Up to Date isn't as explicit with its evidence as other resources, so they may not give you a recommendation of the evidence at all. So if this were the case, if we were doing a regular sort of search, starting with the best, the quickest tools to the longest used tools, kind of that use of efficiency, I would say this is probably not going to be a very useful answer. So I would probably move on from here to try to find a Cochrane or some of the systematic review that would give a better sort of justification for that recommendation, or maybe do an unfiltered search in PubMed. So even though we know from ACP Smart Medicine this is not really an easily recommended intervention at this point based on the evidence, it's still a good resource though, because if I scroll through here, you can see that they show you the evidence they used to make this conclusion in this subsection here. So if I wanted to, I could just click here to jump down in their bibliography to see what this particular resource is. So they did, you can see, use a Cochrane here. I could just click here, go down to their bibliography, number 97. If I click here, it's going to take me out to PubMed. So this is not going to be PubMed. Actually, it is. It's great. So it's actually PubMed linked through BU because I've already logged in once. We do subscribe to Cochrane, the full text. So if I wanted to read this particular Cochrane, I could just click here to get the full text. So it's great that even if you don't find an answer in ACP Smart Medicine itself, it can in many cases can point you towards maybe a better answer looking at the resources they actually cited. So this is no big deal. This isn't working. I'm just going to skip it. It's not that important at the moment. So again, I don't feel like in this particular case, or actually it did answer our question, but it's not the answer we wanted since we want to try to convince Judith to use a glucometer. If we want that evidence, we're going to have to look elsewhere. So ACP Smart Medicine is good in providing answers, and like I said, it's really good if you're not really familiar with this topic. You can use this to really understand kind of every aspect of the topic. So again, what's hospitalization, what's follow-up, counseling, what's all the things I have to do to get a patient used to this particular disorder. But there are some other nice things in ACP Smart Medicine too that admittedly some of our other point of care tools have, but this does some things a little bit differently and I think a little bit better. So I click here onto the home page. So ACP Smart Medicine is one of about 30 titles we get from this ebook resource called StatRef. Excuse me, this is what's called an ebook suite, so it's all of these books contained in one place and you can search them all from just one search bar. But it also has a couple of nice tools here. So you see there's this thing called MedCalc 3000. So a lot of these point of care tools also include things that help you do screening or sort of other aspects like dosage converters. We know there's a lot of math in medicine, so these are some calculators that are built in. So as I said, you could do a converter. Say you had a patient that was a child. The only drug you had was recommended for an adult, so this is like a dosage calculator, how to get the right dosage for a smaller person. But in the case of something like Judith right now, there are a couple of things that I think are really nice. You can see there's this clinical criteria. So if this were, say, your previous visit and you were trying to screen her for diabetes, you could actually use this if I click here on D. They have this diabetes risk score algorithm. So if you had been screening her before, you could use these calculations here to go through and figure out, what Judith's, or perhaps her chance of developing diabetes are if she's diabetic now. There's also this decision tree, which kind of helps you work through, similarly, another kind of algorithm. So you can see here, it's another screening tool here. So you can kind of walk your way through if you're not sure if Judith may be at risk. You can use this algorithm, walk through it step by step to see, and you can see based on her age, that's one factor right there. She's over 45. It's another way that you can it's another way to sort of work your way through the process of how do you do screening, how do you do treatment. So it's really nice that this tool is here, MedCalc 3000. Dynamed also has similar things, but they have more towards the math side, like that dosage converter, whereas MedCalc 3000 is really nice and has these sort of tools like that decision tree and the clinical criteria that can actually help you make a clinical decision.